Hello everyone, welcome back to our channel, and today we're going to talk about supplements and what kind of supplement options are out there in the market today. Okay, so first of all we have Supplement Plan F. Now Plan F is out there, but Plan F, you had to turn 65 by 1/1/2020. If you are not 65 by 2020, you cannot get into the Plan F. Plan F was a very nice plan. It didn't have a Part B deductible and no Part A deductible. It was really a very nice plan. You go to the hospital, no copay. You don't have copays when you go to the doctor. It was a very, very nice plan. But that's, again, not available anymore. The most common, let me write SUPs up here. The most common supplement right now is Plan G. The Plan G is very common. It can be a little bit expensive. We will get into the costs also. The only cost that is in the G plan is a Part B deductible, and that's going to be $257 annually. Okay, $257. That's the one-time $257. After you pay $257, you pay zero. You go to the hospital, you're hospitalized, inpatient, you pay zero. You don't pay anything of a ER copay. You don't pay copays at your doctor's office. You pay nothing. Very, very easy plan to work with, and quite honestly, it's very popular. The next plan we're going to talk about is a Plan N. Plan N is just like the G. It does have the Part B deductible of that $257, but the difference here is that you would have copays when you go to the doctor's office. Okay, you have some copays. Now the copays are going to be like when you go to see a primary care or a specialist, you'd have between $0 to $20 of a copay when you walk into that office. Now they can charge you $0 or up to $20. That's their decision. When you go to the emergency room, it's between $0 to $50, but they can't charge you more than $50, okay? The other part of that is the excess charge. There's a 15% on top of what Medicare would charge for the service, and that would be Part N, or Plan N does not cover that 15% excess charge. So what CMS says is that equates to about $20 on a bill. And so the Plan N doesn't cover that. And quite honestly, when you go into a doctor's office and they say, hey, I don't accept Medicare assignment, I'm one of those 5% of the doctors nationally who do that, you have that option of just leaving that office, going down the hall and seeking another doctor, or you can say, okay, and continue on with that doctor, but you can expect the services to be about an extra $20 at that point, okay? The difference between the G and N, the N's going to be a little less expensive, and I'll get into that as well. The other big plan that's gaining a lot of traction because of the cost is the high deductible G, okay? The high deductible G is very popular. Why is it popular? Because it's the same as the G. You have the Part B deductible, again, that $257, okay? Same as the G, but now you have a deductible to go through. You have to go through a $28.70 deductible first before you hit that $257 Part B deductible. So what that means is that when you go to the doctor's office, you're responsible for 20% of the fee. If you get an MRI, 20% of the fee. If you go to the hospital and get admitted, you would have a $1,676 deductible, which would eat up a lot of that $28.70. The high deductible G is going to be considerably less expensive than that G plan. And when you're healthy, quite honestly, because we are usually healthy throughout the years, this plan is going to save you a lot of money over the G. Now we're going to talk about the downside of supplements. There aren't many, but we got a few. Okay, first of all, let's talk cost. Again, we're talking about Plan G. We're going to go back to G. In the state of Missouri, 65-year-old, a Plan G, right around $215. And for some people, unfortunately, when you add that on top of Part B 2025, that's going to be $185. It can be a little bit expensive. And we look at the high deductible G plan, which is kind of allowing people to get into the marketplace. That's going to be at $73. Again, this is just one of the major carriers, $73. So we have a difference there, a considerable difference, but when we extrapolate that out for a year, that's a $1,700 difference, right? And when you multiply that out for like 5 years in premiums, that's an $8,500 difference. And that is meaningful for someone spending money. Now, yes, you would have to go through deductibles. This does have a $2,870 deductible, but if you're a healthy individual, you're going to be saving money in the long run. And if you have a bad year medically, you're going to end up paying right around $3,100 if you have a bad year medically. The cost of the supplement at times can be a downside. Okay. The other part is that you need a Part D plan. You cannot have a supplement without having a Part D plan. That's your drug plan. And now the drug plans are going to have a deductible in 2026. It's going to be $615, maximum out of pocket of $2,100. Now that maximum out of pocket of $2,100, that's wonderful. What that means is that so long as the medicine that you have, that you're taking is on the formulary, the most you spend in a year is $2,100. That one medicine could be $10,000. But if that medicine's on the formulary, you only pay $2,100 for the year. That's $175 a month. You could pay $175 each month from January to December. That's a real nice benefit. But still, you have to purchase a drug plan separately. So there's an extra added cost. Okay, usually you can find plans between $20 to, let's say, $70. If you're on more expensive medicines, more Tier 4 and Tier 5, you may have to get into the $100 range for a Part D plan. And in 2026, you'll find fewer Part D plans available, but with the help of a Medicare advisor, they'll walk you through that. They have the software to help you make sure you find a plan that meets your needs, okay? The other downside of the supplements is that you do not have any dental, vision, or hearing benefits. I think the dental is really the kind of the most expensive, but then after talking to my mother, who spends about $6,000 on her hearing aids every year, I know actually hearing over here, I know the hearing aids, they're awfully expensive. So yes, dental can be expensive, your root canals, your crowns. So people end up spending money on the dental, vision, and hearing. So you need to purchase this also separately. So you've got separate policy for this, separate policy for the Part D, and then you have your separate policy for either a high deductible G or the G plan. So when you're adding them up, it can be costly. All right, thank you very much for watching, guys. And if you like this content, give us a like, give us a subscribe, and we'll keep on bringing more information to you. Thanks very much.